Welcome to Trial Site News podcast series. Today we will be discussing a first-in-human clinical research study to demonstrate the safety of an investigational surgical technique for patients with newly diagnosed glioblastoma multiforme, which is one of the most aggressive forms of brain cancer. And here with us today to talk about this is Dr. John Boockvar, Vice Chair, Department of Neurosurgery and Pituitary Neuroendocrine Centers at Lenox Hill Hospital, Manhattan Eye, Ear and Throat Hospital in New York City, and also one of the stars of a Netflix documentary series called Lenox Hill. So, Doctor, welcome.
Welcome. Thanks for having me.
The pleasure is ours. So, Doctor, can you share with the audience how you found yourself gravitating towards medicine as a youth? What was your motivators going through high school and into college?
Well, fortunately, my father was a physician. My grandfather, my great-grandfather, all were physicians. So it truly was part of our heritage and tradition and blood, if you will. Not to say that all of my siblings went into medicine. My identical twin brother, for example, went into law. So there's something in nature and something in nurture. But for as long as I can remember, I was drawn to medicine. I'll never forget watching as patients would come up to our table at a restaurant and thank my dad for the care he provided them. And, that has an indelible impact on a young child. And for me, even in high school and then going to college, it was pre-med all the way.
Now, you would later become a world-renowned surgeon, specializing in surgical expertise for providing patients with safe, effective, and minimally invasive treatment for brain tumors, skull-based disorders, and disorders of the spine. Can you talk a little bit about your career and what lessons that you learned along the way?
The biggest lessons I've learned is time management and practice. Time management being, in order to be successful at a high level, you have to know what to say yes to and what to say no to, what to devote yourself to and what to, leave at the wayside. And from an early age, I was always very aggressive with managing my time and devoting myself to the practice of surgery. I think one of the issues in order to develop as a peak performer, which as a brain surgeon you have to practice and you have to do and you have to operate as a resident. I operated and operated and operated. And when I wasn't doing it on humans, I was in the cadaver lab practicing and on Saturdays. And, surgery is about getting good feedback from your mentors and learning. I still study anatomy to this day. My wife will say, don't you know the anatomy already? And I keep telling her, you can never learn too much anatomy because every case is a little different. Every human brain is a little bit different. So study, study, study. That's how you achieve peak performance.
Now, before we jump into your clinical trial that you're doing, for our audience, we'd like to talk about a little bit about your Netflix documentary at Lenox Hill that you participated in. Could you share about your experience there?
We had a terrific experience filming Lenox Hill, and that is because we had a terrific production company, Ulari Films, which is Adi and Ruthie Barash. They really made us feel comfortable. We really knew that patient safety and patient privacy were the utmost concerns. We didn't get paid a cent to do the show. We were just us. We knew we were good at what we did and we had nothing to hide. We wanted to bring to light the truths about medicine and hospitals, the good, the bad, the ugly. And they did a terrific job of doing that in a way that was sensitive to patients' concerns, empathetic to their stories and compassionate. And frankly, they did a beautiful job. We're very proud of it.
So we know that you are working on a first-in-human clinical trial to demonstrate the safety of an investigational surgical technique for patients with newly diagnosed glioblastoma multiforme. Can you introduce the audience to this critically important trial?
I would love to. The new trial that I'd like to introduce is where we take actually portions of a patient's fat in their belly. It's called Omentum. And Omentum in the belly is to protect our viscera, our organs. And within this Omentum are little pieces of your immune system called milky spots. And so the rationale of using this tissue, we take out the brain tumor from the human brain, and in its place, we put a piece of this Omentum or fat. And you may think that's crazy. We're taking belly fat and putting it on the brain. But this is actually a practice that we do for a host of other neurological disorders. This treatment, though, will be the first time it's ever used for human glioblastoma.
Now, what is it about this approach in this study that possibly can overcome the very challenging situation with this aggressive brain tumor?
Well, two reasons why we think this is really exciting. One is every blood vessel that grows from this piece of fat into the brain lacks a blood-brain barrier. So we're now making blood supply that will not have a barrier that prevents treatments that we give orally or intravenously from getting into the brain tumor. So that's number one. The blood vessels lack a blood-brain barrier. Number two is by putting in these immune cells, we're exposing the tumor to your body's own immune cells. And that is something that humans have a very hard time doing. We have a hard time getting our own immune cells into the brain. We're basically transplanting immune cells directly into the brain cavity.
Can you tell us more about the surgical technique used?
Yes, so using cameras, our general surgeons will retrieve a piece of this omentum from the belly, take it out. We actually sew that piece of fat into an artery right in the scalp. And then I, as the surgeon, will then place this piece of omentum directly into the brain.
What happens after the study? What happens to the patient?
So we close the skin, we close the scalp, the patient looks normal. And we follow that patient with monthly MRI scans to make sure the tumor doesn't grow back.
And for the study, what are the primary and secondary endpoints?
The primary endpoint for this particular trial is safety, meaning that we're doing something new that's never been done for GBM. So your first trial always has to evaluate safety. And the safety issues, we always worry about the 3 S's in the brain: seizure, swelling, and stroke. Okay. And we do everything in our power to minimize those risks. We give anti-seizure medicines, we give anti-swelling medicines, and obviously we do everything we can to make sure the brain doesn't have any infarction or stroke. And that's what we carefully watch our entire patient population with.
And what about patients, number of patients, and duration?
So actually this first trial, we only are looking for 10 patients. We like to follow those patients for at least a year to make sure everything is fine safety-wise. And so we're thrilled to be able to offer this to 10 glioblastoma patients.
I want to shift now to talking about your current residence where you're working at Lenox Hill Hospital. Could you share more about the benefits of research and practice at this prominent medical center?
Well, what's great about Lenox Hill Hospital, and having been at 2 Ivy League institutions before this, is our hospital is a very intimate setting. And we just have a very hands-on approach to medicine where patients really get an intimate amount of care. And that is backed by this massive research enterprise that's at our medical school, which is actually out on Long Island. And we run a healthcare system called Northwell Health that owns our medical school, which is called the Zucker School of Medicine. We have 24 hospitals. We have massive research enterprises, including the Feinstein Institute for Medical Research and Cold Spring Harbor Laboratories, home of 3 Nobel laureates. So within this one health system, you have the ability to deliver very intimate care at the bedside, but really do some really terrific basic science and clinical research throughout the whole health system.
What about COVID-19? How has it impacted your work there?
Well, I'll tell you, in February, March, and April of 2020, it impacted us significantly. We got absolutely deluged with COVID patients here in New York. In fact, we had to shut down our clinical research projects for glioblastoma, and I ran all the COVID clinical trials in 2020, where we tested everything from, drugs for COVID to convalescent plasma to vaccines and whatnot. So, and we did that because we were dealing with, it was wartime. We were dealing with a new entity we knew very little about. So we put all of our energies into tackling COVID. And then by May 1st or so, we switched back and got back into our glioblastoma research. I'm proud to say now we have low numbers of COVID, not zero, but it's very easily to segregate that population into a part of the hospital that's safe. We're continuing to provide for our general medical and surgical care here. And it's been a truly great experience having gone through it and succeeded.
Now, before we let you go today, are there any parting thoughts or topics you'd like to touch on?
No, I think these opportunities to share these research trials are important. The one thing I just want everyone to remember is that patients in clinical trials do better than patients who don't enroll in clinical trials, even if they get a placebo. So your chance for living longer and doing better are higher if you enroll in a clinical trial. And that's not just for glioblastoma, that's for any disease in humans. And part of that is because placebo effect is real and observed patients do better, meaning, and that's called the Hawthorne effect. So I encourage all patients to look seriously at clinical trials, make sure the investigator doesn't have a financial interest in the clinical trial, because then there would be bias. And really, if you believe in the safety and the integrity and the scientific rationale of the trial, you should participate.
Well, Dr. Boockvar, thank you so much for taking time out of your busy schedule to speak with us.
My pleasure.